Morning, Emma. Thank you ever so much for joining us today. So, Emma Hutton, you are a General Manager in our Mental Health Services Division and our MHSOP Directorate. And we'd love to hear about your career journey. And you're an occupational therapist by background, aren't you? So I wondered if we could start there and maybe have a chat about what drew you to occupational therapy in the beginning. What called to you about OT?
Yeah, of course. So for me, it was a bit of it was a sort of a coincidental meeting with a school friend when I was coming towards the end of my A levels that kind of shone a light on OT. So I met her, bumped into her by accident. She told me that she was applying to do occupational therapy. And up until that point, I'd been thinking actually about moving into physiotherapy. So I always kind of identified with AHP professions, really kind of liked the values and the holistic approach to kind of caring for people. It was caring for people, I think, that drew me into healthcare in the first place. But I hadn't actually looked into OT until that point. And when I looked into it, it resonated far more with me than any of the other AHP professions. And it was really, for me, it was about analysing activities and the way that what that meant to people, to individuals. And that really fascinated me, actually. So to think about things from a person's perspective and how they engage with their environment and their social kind of networks. So that really tickled my fancy, and that's what drew me to apply for OT in the first place. So yeah, it was a bit of a bumpy road for me to get onto my degree because I didn't get the A-level results that I needed. So I had to go through a clearing process, and I had to really, I think in that process, it puts a different kind of pressure on you. And because I was 18 at the time, and I knew that the pressure was on, that I really had to shine amongst all of these other candidates to make sure that I secured a place. And I think that taught me a lot, actually. But I was successful and I got on to do my training. So I was over the moon about that at the time.
I can imagine. I can imagine. And thinking about your career as an occupational therapist, what have you enjoyed most about occupational therapy then?
I
Or,
think, yeah, for me, like I say, I think the really unique thing about OT and looking at it from an occupation point of view was was always the thing that kind of maintained my passion for the profession. It always kept me engaged, and I think as I started to work in clinical settings, I worked for a little while. I did a mixed rotation when I first qualified, moved into work into adult mental health, and worked into older adult mental health. And I've worked in older adult mental health now for about the past 19 years, obviously more recently in a management role. But it was that holistic view of the person that I think is common to all AHPs. But for me, it was the nuance of coming at your assessment and your intervention from the angle of the activities and what that means to a person. It was something that really interested me and continues to.
yeah, yeah. And you mentioned your sort of move into sort of a managerial role and a leadership role, and colleagues are always super curious as to how that happens. Was it purposeful? Essentially, how did you make that happen? I wonder if you could
Yeah.
describe that journey a bit.
Yeah, so like I said, the majority of my clinical career was within older adult mental health. And I was really content and happy working in a clinical way. And I think there comes a point where you sort of feel like you have to pick a lane in terms of being able to progress. But I was really fortunate in that I was able to develop my leadership skills through a clinical pathway. So I was the clinical lead for the dementia outreach service and sort of worked into establishing that service. It was a new service, thinking about what the service should look like for the patient, And that really opened my eyes to the fact that actually you don't have to pick a lane. It's not about that. Actually, if you move into a leadership or a management role, you've just got a different circle of influence really about what happens in terms of the quality of the patient care. And obviously for the past sort of 5-6 years, I've worked purely in a management role. But I still feel really connected to the clinical work that's carried out in my directorate. And I think for me, that was really important to maintain that connectivity and spend time with clinical colleagues to make sure that as my role is about leading and developing and shaping services, that I understand what it feels like to be a patient on the receiving end of the care that we deliver.
That's great. Thank you, Emma. That was really, really great.
That's okay, no problem.
Thank you very much.